Hi doctors, welcome back to the new episode of our A to Z series where in each episode alphabetically we discuss one of the most repeated previous year topics of INI-CET, NEET PG and FMGE, and our today's episode is episode W where W stands for waist to hip ratio. So let's begin our today's discussion with solving this MCQ. Normal waist to hip ratio in males is more than 0.8 in males, more than 0.85 in females, more than 0.90 in males or less than 0.90 in males. So which option do you think is the correct one? Well yes, option D, less than 0.90 in males is the correct answer. The waist to hip ratio is a measurement that compares the circumference of a person's waist to the circumference of their hips. To calculate the waist to hip ratio, you measure the circumference of your waist at its narrowest point and the circumference of your hips at their widest points. Then you divide the waist measurement by the hip measurement. The formula for calculating the waist to hip ratio is as follows. WHR is equal to waist circumference by hip circumference. The waist to hip ratio is significant because it can provide information about the distribution of body fat, which can be first apple shaped. In this pattern, fat is predominantly stored around the waist area, resulting in a higher waist to hip ratio. This type of fat distribution is more commonly seen in men and is associated with a higher risk of health conditions such as cardiovascular diseases, type 2 diabetes and certain cancers. Second, we have pear-shaped. This pattern involves fat accumulation around the hips, buttocks and the thighs, resulting in a lower waist to hip ratio. Women tend to have a higher prevalence of this body fat distribution. Compared to the apple-shaped distribution, the pear-shaped distribution carries a lower risk of developing the aforementioned health conditions. So thanks for watching and that's all for today. See you in our next episode, which will be episode X.